Hey listeners, this is Kelsey and Nate here from the Emergency Medical Minute, and we are excited to tell you about our next big event, Untamed, an event about medicine and wilderness as medicine.
Picture this. You are canyoneering in the San Rafael Desert, the most remote desert in the United States, and suffer an unfortunate fall that leaves your right hand pinned by a boulder. Posed by the threat of death by dehydration, you have to choose between your life or your limb. Our keynote speaker, Aaron Ralston, portrayed by the film 127 Hours, was in this exact position. Guests will hear Aaron's story, along with other inspiring tales of survival.
Guests will also hear from a panel of medical experts on how to survive the wilderness and embrace it as a form of medicine. Tickets and event information are available on our Facebook page and website, emergencymedicalminute.com.
Okay, so here's your clinical scenario. A 5-year-old male brought to the emergency department by his mom with complaint that he's wheezing. He's had a couple of weeks of respiratory infection, kind of mild, not really getting worse. No prior history of asthma or wheezing. She got him from school where they said he panicked and felt like he couldn't breathe. And by the time they calmed him down, 20 minutes later, she arrived and he was looking pretty okay. So, pretty benign clinical presentation. His stats are pretty normal. It doesn't have any overt increased work of breathing. When you auscultate, he has slightly diminished breath sounds on the left, and kind of a, maybe a little bit of rhinorrhea, not pretty benign looking exam. So nothing to really give you any big red flags. Since his breath sounds were slightly asymmetric, I did an x-ray. And guess what I found? Found a metallic foreign body in his right mainstem bronchus. So, ultimately we never really got a good history of what happened to him. And obviously he was at school, so no one gave us the history of, he put something in his mouth and then choked and had some stridor and then was having trouble breathing and then got better. So basically the aspiration of foreign bodies in children can be very vague in its historical features. In fact, there was one study that I was looking at that had 200 cases, of childhood foreign body and aspirated foreign body, and 19% presented greater than 1 month post-event when they figured it out. Right. So the first pearl is with little kids, especially. You got to be really diligent about getting a history, and sometimes you have to ask the history a couple of times and ask the kid a couple of times and ask the people around the kid certainly a couple of times what really happened. And again, we never really figured out what the foreign body was. I'm sure they figured it out when they bronched him, obviously, but it was clearly a metallic foreign body in the right mainstem. So a couple of other salient kind of statistics on this. In the United States in 2013, there are 4,800 deaths due to inhaled foreign bodies. And then for the childhood group, so 0 to 4 years, that equates to 1 in 100,000 kids having that as their cause of death. It is actually the leading cause of infant mortality under 1 year for non-intentional injury. And then there is also just another stat that I read that in 2016, there were 49 deaths in kids 1 to 4 years old. So, it's not a small problem, and it certainly can be lethal, certainly in smaller children more than older. This kid was atypical, is 5, but he had the sex predominance of boys have this happen more than girls. And then the peak incidence is 1 to 2, but 80% of the cases will be under 3. So again, he didn't really fit the profile for that. The less verbal or pre-verbal kids are the ones that you really have a hard time getting the history, but hopefully they have a caregiver. The things that help predispose them to having this problem is they can stand and walk and they're orally centric, so they put everything in their mouth, right? They also may have an older sibling who may help put something in their mouth. They may, helping. They don't have molars, so they can't really chew very well. The older sibling may not be nefarious. They may be saying, here, have a grape. These grapes are great. And then, the kid chokes and aspirates it into their larynx. The problem objects are the round and smooth things. So hot dogs, peanuts, nuts, popcorn even. And then the foreign bodies lodge most commonly in the right mainstem for the same reasons that we do right mainstem intubations. It's a more direct route, a left mainstem. goes off a little bit more obliquely. Left is 23%, and then 13% lodge in the trachea. As you can imagine, the more emergent airway problems are going to be in the larger airways. But again, this kid had a big old foreign body lodged in his right mainstem, and he was essentially asymptomatic playing on his mom's phone. So they can be very asymptomatic in their presentation. And really, again, it was just fortunate that we got the x-ray, because he is definitely a kid that, had he had relatively normal breath sounds, he would have fallen into that 1 month later. He had his post-obstructive pneumonia, and then that's when you diagnose the foreign body. So, clinical findings: asymmetric breath sounds, history of choking with cyanosis at the time of the event, wheezing, stridor. All of those things are things that should make you think about this. And really, again, this is just to highlight that this is a very poorly characterized by initial history and possibly even subsequent history diagnosis. So you just have to have a high index of suspicion for it. Thank you.